Now I want to turn it over to Dr. Steph Lee, who I'm excited to have on to talk to all of you. Dr. Lee is a pediatrician and an advocate who empowers young people to pursue their passions, who educates parents on the latest advice on raising healthy children and elevates children's health and preventative medicine ideas into public policy. She is exactly the kind of person we want taking care of our kids' health. She's an expert who is driven and dedicated to making the world a healthier place. So thanks for joining us, Dr. Lee, and I'll turn it over to you if you're ready to go.
Yes, thanks so much. Let me share my screen here. All right, so we're going to start off just talking about how indoor air pollution affects childhood asthma. So let me make sure I can. Sorry, I have like 3 screens up. Okay, all right. So just a little bit of what we're going to talk about, talking about air pollution in general, and then also particularly about gas stoves, right? The whole topic of our conversation here today. And then a little bit about children's unique physiology and why it matters so much and why children are a vulnerable population when it comes to indoor air pollution. Commissioner Trumka already went a little bit about the research, but we'll dive in a little bit more about in terms of children, how it really affects their health, a little bit about social justice, and then briefly solutions that you can consider and what you can do at home. So just a broad overview on sources of air pollution. So we're talking about indoor and outdoor, right? So today we're talking about indoor pollution, air pollution, which comes from, wood or gas stoves, right? I just wanted to point out, there are other sources of air pollution, so we don't forget, the broader picture for indoor air pollution, tobacco use, asbestos, of course, mold even as well. And then outdoor, you're talking about the other things such as fugitive dust, urban areas with particulate matter as well from cars, and rural areas from like agricultural and also coals and power plants as well. So we're focusing on a very small part of what we contributes to indoor air pollution. So when it comes to stoves and indoor air pollution, what exactly is the issue, right? So ambient air pollution is harmful to children, especially indoor air pollution, because burning natural gas does create nitrogen dioxide, particulate matter, carbon monoxide, and other byproducts that contribute to air pollution and are lung irritants. So they can lead to respiratory issues as well. The EPA had written back in 2019 already that such exposures over short periods can aggravate respiratory illnesses. So things like asthma, which is a big thing, especially in kids, that we often see, very common, unfortunately, and also respiratory symptoms. So things just like coughing, wheezing, difficulty breathing, and can even lead to hospital admissions and visits to emergency rooms. They've found, particularly with nitrogen dioxide, that can contribute to the development of asthma, as we'll talk about in a little bit. And so in general, children and the elderly are generally at greater risk for some of these effects just because of their physiology. So what makes kids so different, right? So we like to say as pediatricians, children are not just little adults. They're unique in terms of their development. And so at baseline, they do have a higher breathing rate just in general. And that's normal for them, right? And so because of that, they take in greater air per kilogram of body weight. So because of the increased breathing rates and also greater air intake, they receive higher doses of pollutants. This is indoor, outdoor, any type really, because of their unique physiology. As they get older, of course, then they go closer to adult physiology, but that really doesn't happen until maybe late adolescence or even, 18 or older or so. So really something we talk about in terms of pollution is that we really have to protect children because they're already at an increased risk just for the fact that there are children. Also, and the last thing is they may be closer in proximity, right, to pollutants because they're at eye level or height with gas stoves and things. So that may be something that because of proximity also puts them at higher risk. So going a little bit more, into the research aspect. So I'm breaking it down kind of into the gas cooking stove exposure and the indoor nitrogen oxide exposure, because there's been a lot of research specifically just with nitrogen dioxide. So children living in a home with a gas cooking stove do have a 42% increased risk of current asthma. So having the diagnosis of asthma, they found that association. And as well as having a 24 increased lifetime risk of asthma, meaning that they at some points were diagnosed with asthma during the survey time that they looked at. And in addition, in terms of nitrogen dioxide exposure, they found that increasing indoor nitrogen dioxide levels actually increase the risk of having wheezing currently at the time of the study when they did it. So this study was actually a meta-analysis, so that looks like a bunch of different studies together and looked at 41 studies to kind of see in total what the different risks were associated with the gas cooking and the indoor nitrogen dioxide. It was based off of the National Health and Nutrition Examination Survey. So that's a population-based study that the US does every 2 years. And so they take they talk about health and nutrition status of adults and children, and then also do interviews and physical exams. So it's pretty thorough in terms of the information that they gather. And so this study kind of looked overall at not only the questionnaire in terms of asthma, but also current wheeze, and they even looked as well at lung function as well. And then they did find that in homes with gas cooking stoves, if they had poor ventilation, then like they didn't have exhaust fans or anything like that, that even led to lower lung function compared to families that had exhaust fans as well. Even though, as we heard, that may not be the best solution, it's still one potential solution if that's the only thing that you can do. So as we said, really it does affect not only current asthma, but also symptoms of wheezing and also lifetime asthma. So it's certainly something to consider because that's such a huge, if you've ever had any kids with asthma or know anybody who has asthma, it's a very hard disease to manage sometimes, especially if there's a lot of triggers and things that can cause you to have flares and asthma attacks. I did want to note that most of my presentation obviously is about pediatrics and kids because I am a pediatrician, but they have found too that nitrogen dioxide can affect asthmatic adults. So even in adults who do have asthma, it can be a trigger as well for attacks and even affect kind of the same spectrum of diseases, something called chronic obstructive pulmonary disease or COPD. So that is generally almost like an adult version of asthma in a sense, that you have lung issues that can be that can be triggered with irritation. And so that is also something that can be affected with by nitrogen dioxide gas. And then in terms of, I mentioned a little bit, but the poor ventilation issues, this can also have a negative effect on lung function. So this also was based on the NHANES study, which is the National Health and Nutrition Exam Survey. But they did find not only an effect on lung function, but also a higher odds of asthma, wheeze, which is the symptom of asthma, and then bronchitis, like an infection as well. So one other thing I wanted to mention, because we said mainly nitrogen dioxide is one of the main things with gas stoves that you would talk about. But carbon monoxide also can be an issue as well. Carbon monoxide is an odorless, colorless gas, and it is a very potent air pollutant. It just takes a little bit before you can have carbon monoxide poisoning. And it is so toxic because it replaces oxygen carriers in the blood. So it can affect children and adults, obviously. Symptoms could be, blurry vision, headaches, nausea, vomiting. They're very what we call non-specific symptoms, right? You know you feel sick, but you're not quite sure why. And especially since you can't smell or see carbon monoxide if it's there, that's why it can be so dangerous. Sometimes in the most common source of carbon monoxide poisoning is gas fueled like space heaters in the home, but certainly if gas stoves are not functioning correctly, they can also be a source of carbon monoxide buildup, and also if there's not very good ventilation as well. If a child has signs of carbon monoxide poisoning, it's always good to, take them right away out into the fresh air and call 911, just because the oxygen therapy is the main treatment for carbon monoxide poisoning. And so this is one thing where it's not a long time exposure issue per se. It would, unless it's a very, very small, gas leak or something like that. But generally it's just a risk that you can have with gas stoves in general, that if it's very toxic, if you're able to just eliminate this risk at all, that would be great, right? And then the last thing here I wanted to touch on as well is that it is a social justice issue, right? So Black and Hispanic people are exposed to more air pollution than they produce. So we call it climate disadvantage, right? And so unfortunately, just lower income households also may be at higher risk of exposure, as the pollution more readily reaches dangerous levels in small spaces. And smaller homes are more susceptible to higher levels of gas stove pollution just because of, say, cramped apartments, insufficient ventilation, that kind of thing. And so they found that unfortunately, a Black child in the US is just in general not related, say, to gas stoves, but in terms of asthma, the burden is so much stronger. They are 8 times more likely to die from an asthma attack than a white child. And so they experience 138,000 asthma attacks each year attributable to air pollutants, actually. So specifically due to air pollutants, they have a higher rate than white children with asthma. So trying to figure out ways to prevent that, especially in the protect them in a way that doesn't put the burden on them individually, but from a social and government standpoint, it would be imperative. One particular study I want to point out, sorry, I didn't put the reference here, but you can ask me for it. They recruited 150 children from age 2 to 6 in Baltimore, looked at physician-diagnosed asthma in an inner city Baltimore, Maryland. And they monitored indoor air over a 72-hour period in the children's bedrooms at baseline, at 3 months and 6 months. And they completed, asthma symptoms as well. And they found that in the presence of a gas stove and the use of a space heater or oven stove for heat were all associated independently with higher nitrogen dioxide concentrations. And then those higher indoor nitrogen dioxide concentrations were associated with increased asthma symptoms in all the kids. And those were predominantly African-American in the households, and about half were in lower income thresholds. They said 42% were from households with annual income less than $25,000. So just another thing to point out, that it really is something that affects say interstate children, low income households, and our Black Americans. So in order to try to improve their health as well as all of our healths, it's important to figure out a solution to remove this risk as best as we can. So some solutions, which I'll briefly go over, are from a healthcare standpoint, of course. I do a lot of talks and involved with the medical organizations like the American Academy of Pediatrics, the Physicians for Social Responsibility, or PSR, PA, to really talk to our healthcare professionals about counseling patients, and especially our asthma patients, about looking at risk factors within the home, right? Because like I said, when it comes to managing asthma, we see so many children with asthma, but I treat it and then they go home and they're fine. But then if there's a trigger that I can't control, right, then they're right back here, trying to get medical care. So the goal is to really try to figure out, from the environmental standpoint, is there something else that we can try to help improve their lives outside of the office. Of course, community partnerships, and trying to make sure in terms of advocacy that we try to figure out solutions, whether it's, legal protections, government regulation, like we mentioned, things like that, to try to make sure that we decrease this significant risk factor for asthma triggers and respiratory illnesses. And also, I think it's important because it helps to shine a light on our disproportionately burdened communities as well, right? We want to make sure that we lift up all of our Americans as much as we can, and then also especially those who are being disproportionately impacted, and unfairly so, because they're not producing as much of that air pollution, as I mentioned, with the climate disadvantage. Oops, sorry, I'm going the wrong way. All right. And so lastly, just as I mentioned, prevention really is key, because when it comes to asthma, the important point is that, gas stoves, they're associated with the release of air pollutants, and nitrogen dioxide being a major player affecting asthma and lung function in children. So, even though you can't get rid of asthma, you can prevent triggers. And so one of the ways is, trying to help with indoor air pollution as key to managing the illness. And even if you don't have a child, right, we're talking about right before the holidays, there are benefits to try to figure out if there's better options. Because of course, I mentioned, adults also can have respiratory irritants and also COPD, and the risk reduction of carbon monoxide poisoning. And with the holidays, you might have friends and family, people who do have kids as well. So over the long period, you want to try to help decrease that risk as much as possible for everybody's health. And just making sure, that as much as we can, we do want to try to improve indoor air quality. I don't think we talk about it enough, especially in the medical community. I think it's something that we're starting to get a little bit more aware that there are things that we can try to do. But certainly this is one thing that we really need to, make people aware that it is a contributor to indoor, like gas stoves and nitrogen oxide is a contributor to indoor air pollution. Oops. All right, I do have some references on the slide, but you can contact me if you want more as well. My email is there, and I am on social media as Steph Lee MD. So you always feel free to contact me if you have any other questions or want to connect. Thank you.